Hi, I'm Dr. Parveen from Clinic Bangsa South. Basically, I run an STD practice here in Kuala Lumpur. We have been open for the last 12 years. We are one of the leading STD practices in Kuala Lumpur. We have 3 specialists here, Dr. Nirmal, Dr. Akbal and myself. We are very interested in not just screening and treating people, but also creating a lot of awareness in sexual health, education, things to do, how to protect yourself, how to screen yourself, how to vaccinate yourself, and things like that. As we all know, in Malaysia, sex education is lacking. So we are far behind the West and other parts of the world. Because of this, people are not aware, they don't know how to protect themselves, they don't know that they must do regular screenings, they don't know about the vaccinations. Thus, there's a rise in STD cases, STI cases, and obviously HIV cases as well. Before we go on, let me just explain a little bit about STDs. So, if you want to define this, STDs stands for sexually transmitted diseases. This is a terminology mainly used in America. Now, the rest of the world, we use the term STIs. STIs is sexually transmitted infections or genitourinary medicine, GUM. So in the West, we do see a lot of STI GUM clinics everywhere. But as you know, in this country, we don't have much of this. So I actually started off this practice with the other 2 doctors, and we started pretty much one of the first STD practices here in Kuala Lumpur. We've been very busy since, and I think we've done a lot to help the community. Now, in terms of STDs, why is it important? Firstly, STDs, number 1, these are infections. It could be bacterial infections, it could be viral infections, it could be other pathogens like fungi and non-specific urethritis, other things. Now, the special thing about STDs is most of the people, I would say 2/3 of the population which get STDs, STIs, do not show any symptoms. So they are asymptomatic. Now, because they are asymptomatic, a lot of people think they do not have anything, they did not get anything from their last partner or partners. This is why it's important for everybody to know that we have to do regular STD screenings. What I tell my patients in general, the general simple rule would be, get yourself tested for STDs and HIV at least once a year. Or at the beginning of a long-term relationship, both people come in to do your STD screening, so we check. If something is there, we treat them, we clear it up, and then they can't reinfect each other. We do contact tracing for the past partners who are involved, so they themselves can get treatment and they themselves don't spread this on to others. The other thing to note is when there's a high risk exposure. For example, if something happens, a guy goes to a massage parlor, something happens, even if it's just oral sex, then when is the right time for someone to come in to get checked? Is it 1-2 days later? Is it 1 week later? Is it a month later? Well, the answer is 1 month later. The best time to come in would be a month or any time after a month from the time of the exposure. Why? Because at this point, everything is detectable via the tests. We do the blood test, we do the urine PCR test, we do the PCR HPV test for HPVs. So there are a number of things that we can check for. We do the smear test and microscopy, which gives instant results. There are a number of things we need to do. All this is best if we see a person on a case-to-case basis, and we can advise accordingly what is the best thing to be done. The next thing would be HPV vaccinations. I'm a big promoter of HPV vaccines. Gardasil 9 is the latest one, is the best one. This vaccine prevents a person from getting human papilloma virus infection, which is spread skin to skin contact, like herpes. So even if somebody says, I did not have unprotected intercourse, I did not have oral sex, but there was some skin to skin contact with someone having HPV, you can contract HPV. Now, what happens if you contract HPV? After a while, you will develop genital warts. Okay, these warts, if somebody comes to me, I will burn these warts. These warts, skin to skin contact, will spread to the partners. And these warts are precancerous, which is why we are worried. We do not want somebody to develop cancer. So because HPV is on the rise, now we vaccinate not just women, we vaccinate women and men. So if you have a child who's 13 years and above, bring your children in. We get the girls and the boys vaccinated. All adults up to the age of 65 for men can be vaccinated, women up to the age of 45. Now, once we give the 3 doses of HPV vaccine, the person is then protected lifelong. So even if they come in contact with someone having it, they're not going to get it. If they've already been exposed before, by taking these vaccinations, you are then going to suppress the viral load to such a point that it becomes dormant. Once it becomes dormant, inactive, it cannot develop into warts. It cannot spread to another person, it can't turn cancerous. Now, Malaysia finally has recognized the importance of this, and now the government is allowing everyone to pay for these vaccines themselves, and the next year to claim it from their tax. So it's tax deductible. So come and ask us about this, we will explain to you how to do this.